Good day, I am LULUQUISEN, a student nurse, and today I am going to perform the procedures on assessing the skin, hair, and nails of a client. So first is the procedure on assessing the skin. The first thing to do is to assemble the equipment, which are the following: the millimeter ruler, the examination gloves, the magnifying glass, and the record sheet and the ball pen. So first, I will introduce myself to the client and verify the client's identity. I will also let the client know what we are going to do, why is it necessary, and how the client can cooperate. So, good evening, sir. I am LULUQUISEN, a student nurse. Sir, may you state your name and your date of birth?
My name is LULUQUISEN.
And your date of birth, sir?
October 22, 2005.
Okay, so today, sir, I will be assessing your skin, your hair, and your nails. And that is for us to know whether there are abnormal findings or abnormalities in your skin, your hair, and your nails, which may lead us to knowing whether you have skin diseases, or hair diseases, or nail diseases. Okay, sir? Okay, so before I attended to the client, I have already performed hand washing and have observed other appropriate infection control procedures. Also, client's privacy was already provided as I have closed the door earlier because we are in a private room-like setting. So, now we proceed to the interview phase. Sir, I will be asking you questions and may you answer them honestly, sir, because it may help me to accurately document all the findings in regarding your skin. So,
Okay.
I will ensure also, sir, that all this information will be kept confidential. Okay, so let us start, sir. Have you experienced any pain or itching, sir?
No.
What about the sensations of numbness or tingling sensations, sir?
None.
Okay, so, sir, may I ask if you have any body piercings or tattoos, sir? Okay, so, very good. Sir, have you noticed any skin lesions in your body, mga sugat po?
Wala po.
Bruises, sir, pasak,
Wala din po.
rashes po? Okay, so none. Okay, so we will be looking at it later also. Now, sir, do you have any skin problems, or are you aware if you have any skin problems?
None.
Okay, so
Wala.
none. What about in your family, sir? Can you trace if there are any family members po na may mga sakit
Wala po.
such as skin cancer? Wala po. Okay, so next, sir, do you use medications or mga gamot po? Ointments, sir, mga may na-apply po ba kayo sa skin nyo?
Wala.
What about lotion, sir? Nag-lotion po ba kayo?
Opo.
What about, do you have skincare routine, sir?
Wala po.
Okay, so wala. So, are you always exposed to sunlight, sir?
Medyo lang po. Sometimes.
And if you're going out, sir, or whenever you go out, do you use sunblock, sir?
Hindi po.
Okay, so I suggest, sir, mag-sunblock po kayo tuwing lalabas kayo, sir. Okay, so next is do you notice the tendency that you bruise easily, sir? Or nagkakapasabo ba kayo ng madali?
Hindi.
Okay, so hindi po. Okay, so I guess that is it for our interview phase, sir. Okay, so thank you for answering my questions, sir. Now we proceed to the assessment of your skin. Sir, in the assessment of the skin, I will be inspecting the skin of the client, the skin color, the uniformity of the skin, if there are presence of moles or papules. Okay, so first, let us proceed. Okay, so now I will be inspecting for the skin color. Okay, so the color of the client's skin appears to be in between light and light intermediate. Okay, so now the uniformity of the skin. Okay, so it appears the skin is intact. Wala naman pong mga sugat-sugat po. Okay, so excuse me po. Okay, sa face po. Sir, may I ano po? Okay, so here there are pimple marks. Okay, so all of them are already dry. Okay, so also here, there are also mga nanal or macules. Those are not raised. Okay, so may palpate your face, sir. Okay, excuse me po. Okay. Okay, so now we observe for the presence of edema. Okay, so edema or swelling. Sir, may I again inspect Sir, may you please place your feet above here? Okay, so now I'm assessing if the client has edema. Okay, so none. The client has no edema. Okay, so thank you, sir. Now, I will observe or I will inspect for any skin lesions. So, by the way, the gloves are used whenever or if there are lesions that are open. So, now I will inspect for lesions if there are lesions. Okay, so sa paa niyo po, sir, may you again, please, ano po. Sige, papati po sa kanila. Okay, so here there is, it appears to be that there is an insect bite here, right over here. Okay, so wala naman na pong mga sugat dito, sugat-sugat. Again, or this is somewhat of ano po, this is a papule as I can feel it because it is raised. So, sir, yan po ba yung na-notice niyo po bang medyo nag-enlarge or nagbago yung shape?
Medyo po.
Magmula po ng bata po kayo, sir? Okay, so let me first check the size of the papule. Okay, so right now it is less than 5 millimeters. So, sir, may I suggest that you take note if mag-enlarge pa po yan. When you ask any of your family members to check if the papule is getting large. Okay? Okay, so thank you, sir. Okay, so now we observe, i-erase lang po natin ulit, sir. Now, I will palpate, sir, your arms and your lower extremities for the texture of your skin as well as the moisture. Okay, so the skin here appears or feels smooth and dry. Sir, may you again raise your feet up here. Okay, so and din po dito. So also, I have palpated the temperature, and the temperature on both the arms and the feet are equal on both sides. Okay, so now we assess for the mobility and turgor of the client's skin. So, sir, may you sit upright first. Wait lang po. Now, sir, may you lie down. Okay, so now, in assessing the mobility and turgor of the client's skin, I will be pinching this part of the client's skin. So, okay, the skin of the client was easily pinched, and as I release it, the skin turned back immediately or returned to its initial position. Okay, so thank you, sir. You may again sit in an upright position. Okay, so I believe, sir, that is it for our skin assessment. So now, I will just document all my findings regarding your skin. Okay, so wait lang po, sir. Okay, so now we will proceed in assessing the client's hair. So in assessing the client's hair, I will first again observe hand hygiene. And then I will let the client know what we are going to do, why is it necessary, and how the client can cooperate. So now, sir, we will be proceeding in assessing your hair to know whether there are problems in your scalp or in your hair. Okay, so now I will be asking you again questions, sir, regarding your hair this time. Okay, so did you use any products or hair products, sir, such as hair dyes?
No.
Did you curl your hair, sir, in the past? Or have you used devices to straighten your hair?
I did not.
Okay, so have you undergone chemotherapy, sir?
No.
Are you aware of any hair problems, sir?
Dandruff.
Okay, so dandruff is noted. Okay, so now we will proceed in inspecting the client's hair. So first, we will inspect for the evenness of growth in the scalp, over the scalp. Okay, so as I can see it, the growth of the hair is equal from this side to this side. And now I will inspect for the moisture and texture of the hair. So as I can see it, it appears to be smooth and not oily. It appears to be shiny because of the light. Now, sir, may I touch your hair, or may I look for... Now I will be touching the patient's hair and I will be looking for infections or infestations in the patient's scalp. It is important to check for the back of the ears, as well as the parts where it is not noticeable or is not always visible. Okay, so the presence of dandruff is noted, or is really noted. So, sir, iayos ko lang po yung buhok niyo, sir. Okay, so now, we proceed in inspecting the amount of hair of the client from the head to the lower extremity. So, the distribution in the arms of the client, there are lots of hairs also, as well as in the lower extremities. So, it appears to be equal naman po yung distribution niya. So, meron dito, so, as meron dito, sa paa. Okay, so, and then, that is it for the assessment of the client's hair. Now, I will be going to document the findings about the client's hair. Okay, so now we will be proceeding in the assessment of the nails. Okay, so in the assessment of the nails, I will again first observe hand hygiene by using alcohol. And then, now sir, we will proceed in the assessment of the skin. Okay, so it is important to note whether there are abnormal findings again in your skin, to note or to know if there are possible nail diseases. Okay, so first, I will start again, sir, by asking you questions. Do you have any history, or do your family members have diabetes mellitus, sir?
Yes.
Okay, so what about peripheral circulatory diseases, sir? Do you know any? Okay, so do you have or have you had any severe injuries, sir, during the past?
None.
What about severe illnesses?
None.
Okay, so now I will proceed to the assessment of the nails of the client by first inspecting the shape of the client's nails, fingernails. So it appears to be normal, and excuse me, sir, if may I raise the angle of the nails from the bed of the nails appears to be 160 degrees, which is normal. Okay, so now I will be also inspecting for the texture of the nail. So it appears to be hard and immobile. So that is normal. Now, as well as in the toenails. So, excuse me, sir. Okay, so normal. It's also normal. Now the tones, as I have inspected it has pink tones, so which is normal also. And now, I will be looking for the surrounding tissues of the nail. So, the tissues appears to be intact, but on the other hand, okay, so there are no hangnails. Also, I have also observed that the nails of the client are clean and short. Okay, so that is good, sir. So on your finger, on your toenails as well, the tissues are also intact. Now, sir, we will proceed in the test for capillary refill. So, may I, sir? Now, I will just pinch this part and then release. Okay, so the the color of the skin returned to normal in less than 2 seconds. So that is considered as normal. Okay, so now that is the end of the nail assessment. So I will again document my findings about the nails of the client, and then that is it for the skin, hair, and nail assessment.